This is Malamulo Adventist Hospital. Every day, hundreds come here in urgent need. Mothers in labor, trauma patients, children fighting for their lives. For more than 700,000 people in this region, this hospital is their only lifeline. In this region, a delayed emergency surgery often means the loss of life. Malamulo Adventist Mission Hospital is not simply a facility, it is the community's only chance for survival. Every decision here is made against time. With limited resources and overwhelming demand, each moment can mean the difference between life and death. Here, a small team carries an enormous responsibility, saving lives with whatever they have, whenever they can. But what happens after the emergency is over? What ensures that tomorrow and the day after, there will still be skilled hands ready to act? The answer lies not only in what happens here, but in how this work is connected to the world beyond. As a global campus of Loma Linda University, Malamulo is part of a worldwide commitment to train, equip, and walk alongside those serving on the front lines. Here, education is not distant. It travels across continents and arrives exactly where it is needed most. Through PACS, the Pan-African Academy of Christian Surgeons, surgeons are trained in Africa for Africa. This is not short-term mission work. It is long-term investment, passing on skill, responsibility, and calling. One trained surgeon can serve tens of thousands. One program can shape generations. This work is grounded in faith, guided by compassion, and sustained by hope. Because saving lives is urgent, but building those who will save lives is how the mission endures.
It's a training that's not only training surgeons, it's also training, getting us prepared for Christian service, specifically mission service, and that's specifically why I like training in the PACS program. We treat patients who really have nothing. They literally just come from nothing. They come here with just hope, like these guys will help us. And I think that's the one thing that PACS really emphasizes, to treat our patients with empathy and really care for our patients, like I mentioned, holistically. I do wish and hope to serve in a mission-oriented hospital. I think my whole life has just been mission-oriented, and I think that's really where my heart is. I may go somewhere do my fellowship, but eventually I'll need to come back and just serve in a mission-oriented hospital. Maybe it'll be Malamulo.
All right, I'm Taylor Wardeman. I'm a PGY4 surgery resident at Loma Linda. There are so few specialists that the general surgeons are really covering everything. They're covering general surgery, urology, C-sections, gynecology cases, plastic surgery. They're really doing everything. And so you do feel like you're a little bit overwhelmed with all of the things that you need to know, and then you realize that the colleagues you're working with, even though they have less gadgets to work with, less equipment, less supplies, they're doing really high quality care. Residency is key for shaping future surgeons. That your experience as a resident will determine how you will do as an attending. And the way PACS does it, it's very education focused. So there's so many different educational modules, educational sessions related to covering everything in surgery, and the experience is key. And a program like PACS is massive. The benefit of a single surgeon to a system is massive. It essentially it moves a hospital from being able to provide some services to being able to provide most services. All of the amazing thing that they do here is done from pure human effort. People coming together and saying, like, we need to find a way to help the people that live in this community. That being said, there's always supply issues. There's always electricity, water issues. Each day there's a different small crisis that a clear need for more supplies, more equipment, more secure power, more secure water access, and all of these things will lead to more efficient patient care if there was good access.
The doctors are very friendly, they are good, very cooperative. Anytime you complain, they assist you. I will tell people wherever I go that Malamulo Hospital in Cho is the best in Malawi.
This hospital is helping people in different diseases, especially surgery. They are doing very well. No one is complaining about the surgical people where they do surgery. Everyone, according to my experience, who go to surgery, they come there alive, which is very, very, very appreciation. I ask you and all the staff to work hard and to ask some people to give financially, and I mean financially, that this hospital can continue to help people around this whole Malawi and outside the country. Thank you.
At Malamulo Adventist Hospital, we're privileged to care for thousands of patients each year and perform thousands of operations. One of the things that we would like to do is expand this care and coverage to even more patients in need. The reality on the ground is we do have some significant challenges. We still use a wood-fired steam boiler system to autoclave and clean our surgical instruments. This exposes us to multiple weaknesses in the supply chain. The wood has to be harvested and brought to the site. Then it has to be split by hand and loaded into the boiler. Clearly, any variation in weather can cause impact on that supply chain. Malawi is a landlocked country, so oftentimes we struggle to get fuel, which is important for every step of the process, as well as our backup generator. If we have unreliable power from the grid here in the country, this can impact our ability to pump the water to make any of this possible. And then simple things like rain can make the wood wet or allow our laundry not to be dry enough to use this system. With these kinds of challenges, this places us at high risk to have to cancel or move surgeries or even not be able to provide life-saving surgical care. We're very excited about our new theater that generous donors have contributed to. It will have 6 new operating rooms and 3 dental chairs. The building has been completed, but due to the water and power, we're still waiting to move in. Once we have reliable water and power to keep our equipment going and enable us to keep operations going smoothly, we can dramatically expand our surgical coverage. This is really important to us because more surgical coverage means better training for our trainees, better patient care, and more effectively spreading the love of Jesus to patients in need.
These rooms stand ready. The equipment is in place. The calling is clear. What's missing is what will bring this hospital to life. Your partnership can turn empty rooms into places of healing and open doors to care for thousands who are still waiting.